Is there a doctor available yet? Is there anyone here who can see me? Anyone?
There will be a doctor in here shortly.
The pain is excruciating. Please, can I talk to someone?
Oh, I'm just.
How much is just gonna talk?
How long is it going to be?
Just a minute, please.
Oh my gosh.
Can you listen to me?
Please help!
To enhance health, serve our community, and provide the best possible experience for everyone who walks through our doors, Lakeland Healthcare has developed traits which are expected of all of our team members, volunteers, and physicians.
Teamwork.
Respect.
Accountability.
Inspiration.
Trust.
Safety.
Our traits directly impact the pillars that help support our mission to be the leader in the safe, high-quality, patient-centered, compassionate, health-related services.
We are here to tell the stories of those we have served, some better than others.
With many, we have succeeded.
With others, we have not.
With all, we have tried to do our very best.
Trying is not good enough.
We want to succeed with everyone.
We must succeed with everyone, every person, every interaction, every time.
We want them to know that each and every person is special.
Each and every person is a human being.
Not just a number or a disease.
Yes, I am not diabetes.
I am not the uninsured.
I am not a heart attack.
I am not the overdose in room 103.
I am not a prescription.
I am not the lazy woman down the hall who complains all the time.
I am not a wheelchair.
I am not trying to make your job more difficult.
I have a family.
A brother who loves me.
A granddaughter who loves to play catch with me.
A husband who needs me.
Will you be there for me?
Restore my hope.
Maintain my dignity.
Give me the best care possible.
Yes, we are here to help save lives.
Well, can you save me? I just need the pain to stop.
I'm not really surprised. My grandmother suffers from dementia and sundowners. I was visiting her the other night, and when I got there, she was completely miserable. It was around 9 p.m., and her pain meds had worn off. Her next dose wasn't scheduled for another hour and a half, so I just tried comforting her. In the meantime, but she just got so agitated. She was crying, screaming, ripping off her bandages, and trying to pull her IV out. I went out to try and find a nurse, but there was none to be found on the floor or at the desk.
Wait, you said she had dementia?
Yeah, why?
Well, I wonder if it's a misunderstanding of mental health.
I mean, maybe. It could have just been a night that they were understaffed. Who knows? It was totally unacceptable. Why would you make that connection?
I'm getting hangry. Where is the lunch?
Let me go see what's taking so long.
Next.
You'll have to make another appointment.
By all means, don't have any answers for me, but keep the bills coming. Thanks.
I was directed to follow up with my PCP, but I just moved and no one is taking new patients for months.
I keep getting passed on to someone else.
She poked me 3 times and used the same syringe after setting it down.
I was sent home with someone else's discharge papers.
But what if I can't afford the surgery?
I don't understand how to use this.
Hablas español.
Next.
Offices need help.
His light is on again.
I think she's just trying to get drugs.
He doesn't understand the ramifications of his requests.
It's just gas pain. She just needs to get up and get moving.
I hate coming into this room.
What could he possibly need now?
What smells?
Are you sure she took her meds as directed?
Hey, I'm right here. I can hear you. And yes, I took my meds as directed. Talk to me.
We're overworked.
You're
understaffed.
We
just need help.
Please, I just need the pain to stop.
You know, despite my complaints, care here sure is better than it used to be.
Well, I can't say enough about the care I've received here. My future was looking pretty bleak. At 45 years old, suffering from hypertension, diabetes, coronary artery disease, and congestive heart failure, I needed to have open heart surgery. The surgery was successful, but I was struggling. Within a year, I was at the ER 9 times and hospitalized 3. All I wanted to do was be able to take care of my family, and I was barely able to take care of myself. A team of Lakeland staff visited my home to better understand my needs.
Yes, our interagency care team was created to collaborate on health initiatives and research in order to give help and hope to people in these types of situations. We were determined to do everything we could to improve her condition.
Teamwork.
I needed help learning how and when to check my blood sugar, and help getting my medications and understanding why each one is important. Honestly, I needed to know how and when to help myself and when to call my physician.
It really just took a couple visits and a little education.
Yeah, within 18 months, I didn't make a single trip to the ER or require any hospitalization.
We recognize that highly effective and highly reliable teams are required to deliver exceptional patient care. 3 different organizations came together and accomplished something more impactful than any of them could have done alone. We were able to help her do what mattered most for her, take better care of herself and her family.
You improved my quality of life.
Yes, absolutely. We all hope that when a loved one comes into someone else's care, that they will be treated with love and respect.
To make a stranger feel loved and respected is such a high aspiration to us. It's the type of care we would expect for our families. You wrote a letter to the editor that was so well written and so representative of how we strive to care for everyone who enters our facility. Would you mind reading it?
Not at all. I'm writing to extend my heartfelt gratitude to Lakeland Hospital. Their compassion and professionalism is top-notch from all of their employees. Their love, respect, and goodness towards each other was the first thing I noticed. In a world of suffering, you people make all the difference with your kind words and care. Southwest Michigan has a gem of a health system. I encourage all who find themselves needing health care to consider Lakeland Health. It takes courage to face the daily grind of difficult situations as they apply their expertise in the healthcare arena. I extend my heartfelt gratitude to Great Lakes Heart and Vascular. In January of 2012, I experienced a heart attack due to an artery blockage in the left ventricle. I was rushed to Lakeland St. Joseph. That evening, Dr. Christopher Chu and the emergency staff installed a stent, saving my life. Please don't ignore heart pain. Hesitation will cause heart damage. On August 23rd, another procedure was done to implant a defibrillator. I'm doing very well post-implant and enjoying life to its fullest.
We can get used to all the drama of healthcare, but what is routine for us is not routine for those we serve. The stress, anxiety, uncertainty, fear, and pain that is so often a part of being injured or becoming sick makes our love and respect even more impactful, even more memorable, and even more powerful in helping our patients heal.
Respect. I'm really trying to be patient here. I have been waiting for over a half hour, and not one person has come in to see me. I'm in so much pain. I don't think they understand.
Sometimes it's hard for the staff to understand our patients. We do our best.
I love my job, and I love my patients. As a home health aide, I work hard to make sure they get everything they need. I have to say, I was completely shocked and afraid when the police pulled up to my house.
So what happened?
The police were responding to a complaint filed by one of my patients. She thought I had stolen a valuable piece of jewelry. I know how precious it was. It contained stones given to her by her husband and children. In the past few months, she had brought up that it was missing, but I never imagined that she would suspect me of taking it. I shared my side of the story with the police, and as they were going through my car, they found a small prayer book. See, I always write down the prayers I offer on behalf of my patients. In it was an entry that I wrote a prayer about my patient's loss and requested that the valuable brooch would be found. I knew it wasn't enough to prove innocence, but I hoped that it would demonstrate the full heart and soul with which I care for my patients.
Your prayer was answered. The brooch was found. And though it would have been understandable for you to be angry or resentful, you were filled with joy and forgiveness.
My manager suggested that I should probably not go back to that home and continue caring for that patient. It was painful, but I complied.
As it turned out, your patient wanted you back. She wanted to be cared for by her own home health aide. She wanted to be cared for by you.
Yes, funny how that happens. She apologized. Ultimately, I'm committed to the health of my patients. You never know what underlying emotions or experiences are driving a certain behavior.
Accountability.
Who is holding who accountable when I'm being told two different stories about my insurance? I'm not someone to complain. I'm not even complaining, really. I just need answers.
I think that is the worst. The high price of healthcare, especially when you get no answers.
I was told by my doctors that Lakeland will not accept McLaren, but I was told by the state of Michigan that if you accept Medicare, you must accept McLaren. None of the doctors that I've been seeing will see me after the first of the year, even though I have prior authorization. Then I'm told that I cannot be seen unless I'm paying cash. I can't afford that. So now I'm running out of my meds and I can't see anyone to fill my prescriptions for the time I'm no longer under care. If I have another stroke, I cannot be seen at Lakeland. I have to go out of town for lab work. I have a condition that requires month-to-month monitoring, and I just don't know what I'm going to do. I keep getting the runaround, and I'm desperate.
Desperate times call for desperate measures. I mean, I lied and used my sister's insurance because I needed a surgery that I couldn't afford. I don't know what comes next for me, but what are you going to do? No one has answers. Even a payment plan was so outrageous there's no way that I could afford it.
A large part of our community is uninsured, so we do have to find a way to provide affordable care, and we have to make that happen pronto.
¿Tú hablas español?
No.
¿Español?
No.
¿Español?
No.
No tienen que gritar, no los entiendo.
I can translate for you. She says you don't have to yell. I don't understand you.
Yo soy un inmigrante de Costa Rica.
I am a recent immigrant from Costa Rica.
No hablo mucho inglés.
I don't speak much English.
Ustedes tienen traductores muy buenos. Me ayudan bastante y se lo agradezco mucho.
You have translators who are very good. They help me a great deal and I'm very thankful for that.
¿Es posible explicarle a las personas en la clínica, farmacia y hospital que yo no los entiendo aunque me griten?
Is it possible to explain to the people in the clinic, pharmacy, and hospital that I do not understand even if they shout?
That's a good point. We can all use a reminder from time to time.
All I know is that would have been the worst day of my life turned into a very miraculous story. The ear doctor said there is no medical reason why I'm alive. I was admitted with severe hypothermia and overdose. Each staff member that was involved, from the chaplains to the doctors, honestly, every single person we interacted with throughout my recovery touched our hearts and our lives. My family and I have such a strong desire to let all of the involved staff know how much we appreciate them.
Inspiration.
There truly are a lot of inspirational stories.
Zach helped a patient whose car wouldn't start during a cold snap. He helped jumpstart her car.
Linda walked home to get her own car so a patient didn't have to walk home himself.
Maud baked sweet potato pie, white cake, and greens for a patient after her husband passed away.
Kyra saved a patient's life by calling 911 when she was unable to get in touch with her for a home visit.
Lindsay cooked a patient her favorite foods and brought them to her house.
Paula helped a tenant at a local residence tower become a volunteer so she could help others that lived in her own community.
Kevin sat with a patient who had no family, sang to her, and stroked her arm as she breathed her last breath.
God darn it, you have some of the finest folk working for you here. Take it from me, an old geezer. This kid Tom shows up at the house to pick up a bed, and see, I was staying at the house for the weekend, but heading back to the nursing home on Monday. My wife Martha's in the other room explaining it to him, and well, here I am in the bathroom just yelling and just pissed all over my darn self. Darn catheter wasn't working, spilling all over the place. Well, this kid comes in and I tell him I can't make this darn thing work, right? And I just don't get it. He tells me something's missing, and without a second thought, he's out the door to get that missing part. He comes back, shows me how it works, helps me get cleaned up, and darn it, he gets on his hands and knees and starts cleaning the bathroom floor. Such compassion can't be bought. It must be given. His initiative and sense of humor about the whole situation made an unpleasant experience as good as it could be. It's hard for a man to ask for help wiping his own butt, but I appreciate his understanding of how important it is for a man to maintain his dignity, and especially for me, a man who needed it in the worst way. Embarrassing, that's for sure.
I've got an embarrassing story myself. Not quite like that, but it was so dumb. When you're training for triathlon, the last thing you want to hear is you may never walk normally again. I suppose there's really no good time to hear those words. It just happened to be particularly crushing, no pun intended, because it was such a stupid accident that caused such massive damage. I lead a church youth group, and while I was playing tag with some of the kids, my foot got caught under a piece of playground equipment. I hyperextended my leg and shattered my tibia just below the knee. After receiving the results of the x-ray, I found out I was the 9th person in line with a broken bone. Somehow, someone recognized that my x-ray indicated a more serious injury than just a routine broken leg.
Dr. Spezma caught it immediately and put her next in line.
Yes, he recognized that the fracture could be more serious and ordered a CT scan.
The main artery to her lower leg had been severely damaged, and her lower leg was not getting enough blood to survive.
I could actually lose my leg. I couldn't believe it. It was such a stupid accident.
It's a frightening thing for parents to trust their beloved daughter to a hospital in a dire emergency. But we soon learned we didn't need to worry.
The care I received was very thorough, and my physicians were honest with us about what was going on every step of the way.
During Dr. Sebesma's initial surgery, he notified a doctor who wasn't even on call, Dr. Durham. Not even on call and on a holiday weekend, he came in and spent the rest of the night saving our daughter's leg, doing intricate restoration of circulation that we have since learned he is legendary for.
I'm now back at it, walking, running. I'm back teaching.
She was carefully warned that she must expect some issues with a leg that would never be the same again.
But yeah, I don't have a limp. I don't use a cane, and now with nerve restoration, I'm slowly regaining feeling in the front of my lower leg.
We cannot fully express how grateful we are to Dr. Sebesma for his expertise in trauma medicine, and grateful to God that he was on call that weekend, and Dr. Durham, who worked all night doing his magic.
The nursing staff in critical care, the neuro-ortho ward, and the physical therapist who helped me work through major pain as I reestablished movement.
Our family has crucially benefited from the excellent medical care and hospital you have had the vision to build up.
I feel inspired each time that I think back on it.
It makes a difference when you can tell the staff are actually working on your behalf instead of just working for a paycheck. And you can certainly tell who is who. I was darn near ready to refuse surgery because I felt I had been passed around like a basketball and no one was listening to my concerns. I came into the ER for kidney stones and I was told that Dr. Stockton in urology was consulted. I agreed to be admitted and have the surgery the next morning with Dr. Stockton. Morning came and Dr. Whitecoat enters the room to do the surgery, but I had heard Dr. Stockton was good, and that's the only reason why I stayed overnight. I thought this was ridiculous, so I refused the procedure. The emergency room should not promise one thing and then expect their patients not to be upset when they don't deliver. I heard this thing happens a lot. I started getting dressed and I was just about to unhook my IV when the safety advocate came in and stopped me.
The operating room called me at 7:30 a.m. with concerns that there was a patient refusing recommended treatment. I asked the OR if he made his own decision, and they said that he did, and he was on the post-surgical floor. I decided as an advocate for the patient that I would like to go and listen to his story. I noted that he appeared frustrated, a grown man in tears. I knew I wanted to hear from him what was going on.
Someone finally listened to me. Someone finally listened to me. She came in as a safety advocate, but I could tell that she was truly there to advocate for me.
I acknowledged his pain, apologized for all the confusion, and I asked him not to leave.
She said that she would go right then and try and work with the physicians to see what their plan was. That was enough to get me to calm down, and I decided to stay. I felt listened to. Sometimes that's all it takes.
I met with the PA and Dr. Stockton and let them know his frustrations. Dr. Stockton said that he would go right in and speak with him. They spoke and worked through the confusion, and then he was discharged.
My surgery was rescheduled as an outpatient for the following week with Dr. Stockton. I also appreciated the out-of-pocket charge for my overnight stay was waived.
Safety.
Sounds like you got lucky. In terms of safety, my experience leaves a bit to be desired.
Yeah, safety is what I'm afraid for right now.
Aren't we all? You know, the US has the worst rate of maternal deaths in the developed countries. I would have never believed that until my experience. A cesarean section wasn't exactly the way I imagined giving birth. I was in such incredible pain that I couldn't get out of bed the first time the staff tried to walk me after the procedure. I kept being told that there was nothing wrong, that I just had gas, and that I was being lazy. Lazy. For an entire week, I was unable to use the bathroom, and yet the doctor kept telling me that there was nothing wrong. I asked for a different doctor and for a transfer 3 different times. Finally, when I was supposed to be discharged, there was enough concern that they got another doctor to look at me. My kidneys were failing, and my bladder had been cut. My bowels were so backed up, they had to use a tube to empty it. I had 3 separate surgeries to make the repairs. Due to the infection, I was on antibiotics, and I was on them for so long they killed the good bacteria. And I had to be catheterized for 45 days.
I'm worried about my safety.
So you said.
It's been an hour.
It's been an hour. Has anyone been in to see you?
Intake.
That's it? Let me see if I can get someone in here. Jordan's been in there for an hour and has yet to see a doctor.
We'll get someone in there as soon as possible.
Don't you hear her in there? She's clearly in pain. Can you do something to help control her pain?
We have to get the labs back before we can administer any pain medication.
See, I came to the emergency room with a mental health emergency. I came in because I was suicidal. I was in insurmountable pain. The kind of pain that makes your heart feel like it's going to explode. Your eyes feel like there's stones rolling around in your head. Even your hair hurts. Each gasp of breath felt like daggers. Talking was nearly impossible, and you didn't know how to explain it. You just know you wanted it to stop.
If I hadn't been there, I don't know how long she would have been waiting for a doctor. I work here at Lakeland. I was appalled. Our staff needs to be better trained in mental health.
I called a friend who works for Lakeland while I was on my way to the hospital. She got there as soon as she could. But by that time, I had already been alone for an hour. She waited with me while I stuttered through naming all of my medications and dosages, while I struggled to explain my medical history and my insurance situation, and all while I was clawing away at my skin, feeling like it was suffocating me. All the questions asked could have been answered by looking in my charts. I know that between the scratching and the crying and the screaming in pain, I must have looked like a junkie going through withdrawal. I know there is proper protocol. But it's circumstances like this that it needs to be reevaluated, though. In that hour I was alone, I could have killed myself.
But you didn't.
No, I didn't. It wasn't a physical emergency, and I think that's why I wasn't treated urgently. That is wrong, because I was still near death. Believe it or not, I still trust this organization.
Trust.
You still trust after that experience?
See, Dr. Lynn Todman, she was the friend I called, and she saw what happened and how. I trust that she will put in the effort to further educate and train the staff in mental health. Also, a follow-up appointment with Dr. Lowell Hamill provided me with some hope and comfort. He reminded me that bipolar disorder is not a death sentence, that I was in good company with some brilliant minds who also suffer from manic depression. Having such strong leaders and physicians who recognize the complexity of mental illness and respects its validity. Gives me promise that the organization as a whole will catch up.
It's a process.
Treat me and my diabetes.
What do you mean you don't accept my insurance? I was pre-authorized.
I don't understand why you can't explain it to me.
Dementia does not mean disposable. Why weren't there any nurses available?
I am not less because I have less means.
Please don't call me lazy. I'm in pain.
I'm not being unreasonable. I just want to be listened to.
I may not speak the language, but I still deserve respect.
This is serious, and I need to see a doctor.
Where's the doctor?
The doctor is not God.
Yes, and I am not diabetes.
I am not uninsured.
I am not a heart attack.
I'm not the overdose in room 103.
I am not a prescription.
I'm not the lazy woman down the hall who complains all the time.
I am not a wheelchair.
I am not trying to make your job more difficult.
I am not crazy, and I am not making this up.
I have a family.
A brother who loves me.
A granddaughter who loves to play catch with me.
A husband who needs me.
Will you be there for me?
Restore my hope.
Maintain my dignity.
Give me the best care possible.
Treat the whole person.
Help me belong.
Listen to me.
Respect me.
Look at me.
Smile.
Extend grace.
Wash your hands.
Yes, it is the way you and I would want to be treated.
It's the way we should strive to treat each other every day.
Emotions are what makes us human. We are here to improve the human experience.
We
are here to help save lives.